to those who've stayed around for this next session. You've heard us talk this morning about the publication of this this paper launched last night. They heard that we were doing the Health and Climate Initiative. Lancet heard we were doing the Health and Climate Initiative and allowed us to coincide the publication of this paper, which was led by Yu Ming and Rong Bin and his group, and I presume a number of you in the room might be authors here. So thank you so much for joining, and for those of you, I probably should stand here. I believe there's some people on Zoom, but this paper is one of a series of six papers that the Lancet Regional Health has commissioned. And we're going to hear about two of them, the paper from Australia that Yu Ming led, and then also the one from China. And I think the other papers are still being finished, being finalised, and going through review before they're going to be accepted. But it will comprise a series of 6 country views of looking at climate impacts on health and adaptation measures. So it's my pleasure to first, and for the second time today, but to introduce Yu Ming Go. I think most of you in the room already know him, but he has really championed health and climate work and research in Australia, and I'm really looking forward to his discussion of the situation in Australia. Thanks, Yu Ming.
Okay, thank you, Karen. Thank you for the introduction, and congratulations again for the initiative for the climate health. This is a great opportunity for all of us, and including our group, to have an umbrella, in the university and across the world, to do the work together. So for this paper, that is one of the paper for the series of climate health adaptation in Asia Pacific. So the next talk will be John Ji from Tsinghua University. He will give a talk for the situation in China. I will talk about the Australian situation. So I want to, at first, I would like to acknowledge the traditional owners of the land on which we meet today. And I would also like to pay my respects to the elders past, present, and the future. Okay, so we can see that this is the author list we have. The first author is Rong Bin. He has done a lot of work for this paper. And also we have a number of authors, co-authors from more than 10 institutions. We work together to summarize the climate change environmental extremes in Australia. And we wanted to find if there is any gaps or if there is any challenges. And also we wanted to give some the recommendations for the future. Okay, so I declare there is no conflict of interest for this presentation. So the background and aims for this paper: climate change already happened, not only in Australia but also across the world. You can say this year, global warming is very serious. Maybe we don't we can't say global warming. We should say global boiling. Because everywhere is very, very hot, particularly in the North Hemisphere. But I think this summer in Australia will happen again. Yeah. And climate change is a big issue and a major public health threat in Australia. But Australia's response to the climate change crisis has been inadequate and subject to the change by politics, public sentiment, and global development. So the government of Australia should do a lot of works and to change some policies or something. So from this paper, we aim to illustrate the spatial temporal patterns of selected climate-related environmental extremes across Australia, including flooding, drought, bushfire, and heat waves. And also we aim to summarize climate adaptation measures and actions that have been taken by national level, state level, and the local government. And also we aim to discuss the communication and the policy recommendations and to improve the strategies for climate change adaptation in Australia. So hopefully we can have a bright future. So this is a selected environmental extremes. So the first one, that is heat waves. So we all know, we have experienced very serious heat waves in the last century, and it will continue to be hot, and the heat wave will be lasting for more days, and the intensity will be higher. And another one, that is wildfire or bushfire. So if you have been here in Australia in 2019 and 2020, I think you can still remember how serious about the bushfire smoke, wildfire smoke in Australia. Another one, that is flooding. So in the North Hemisphere, nearly every country have experienced flooding. And even in Australia, the New South Wales, Queensland have been affected by flooding. And another one is drought. Drought is another very serious problem because of climate change. In Australia, particularly, agriculture is a very important sector. But if there is a drought, the agriculture industry will be affected a lot. It's related to the nutrition, or if there is malnutrition, that means the human health will be affected. Okay. So the first one, that is heat waves. That is for the left, that is the spatial distribution of heat wave days in Australia from 2000 to 2020. So we can say nearly, maybe almost everywhere they experienced heat wave days, and every year they experienced more than 11 days of heat wave days. But in some part, there are serious problems, like in the north and in the northeast. Some of them have more than 17 days of heat waves. That is a very important issue because, from our studies or other group studies, it is very clear heat wave can increase the risk of mortality, morbidity, and also can increase the blood pressure and can decrease the lung function. So that means if there is a serious heat waves, our health will be affected a lot. For the right, that is the temporal distribution for the heat wave days from 2000 to 2022. But we can say from 2000 to 2018, there is an increased trend for the heat wave days. But from 2019 to 2022, the heat wave days has a little bit decreased trend, but we can't say, in the future it will be decreased. This is just a very random thing or something. But if we look at a projected trend, there will be still increased trend for the heat wave days in the future. And this is some strategies or some already developed adaptation policies for the heat waves in Australia. So in general, National Bureau of Meteorology has already developed a heat wave warning system, and they are responsible for the definition of heat wave and how to define heat wave days and how to develop the heat wave warning system. But to date, there is no assessment to say if the heat wave warning system are effective or not. And also, if we want to develop a heat wave warning system, we also need to understand which group population are more vulnerable. So the state or territory health department are responsible to identify the high risk population affected by heat waves. So if we have this target, that should be easy to develop some more targeted plan. And also state and territory health department have published some heat protection advice to reduce the heat illness risk. For example, at personal level, they can advise you should drink more waters in the heat wave days, don't go outside, and use air conditioners or use fans. And also, some states have started to think about or have already developed some urban planning. For example, they plant more trees, more grasses to make the city cooler, because the urbanization that is related to the urban heat island. So if there are more trees, more grass, it can reduce the temperature in the urban center. And also, the green is not only reduce the temperature itself, but also can mitigate the impact from heat on the health outcomes. Okay, that is a double benefit. But there are still some gaps or challenges. So urban planning are still undertaken by local government, for example, to develop some street trees, but there are still a lot of work still needed to be done in the future because not all the government have considered about that. Okay, this is another indicator that is bushfires or bushfire smoke. For the left one, that is the spatial distribution of days exposed to substantial fire-related air pollution in Australia from 2000 to 2019. So we can say, in general, southeast and north and northeast are more affected by the bushfires. And for the right, that is the temporal distribution of days exposed to substantial fire-related air pollution. So we can say, if we remove the data before 2005, there is a little bit, flat trend. But 2019 is a special case because that is the Australia bushfire and wildfire, that is Black Summer. Okay, so that is a very serious situation. But after that, we don't have data. If we have the data, maybe the situation will be changed. We will continue to work. Okay, so for the policies regarding adaptation to bushfires or bushfire smoke, there are two parts. The first part, that is bushfire itself. Another part, that is bushfire smoke. Regarding the bushfires, in September 2022, the National Emergency Management Agency was formed to provide national strategies, oversight, and coordination during the bushfire disasters. And also, Australia warning system was designed to reduce risk from bushfires. And some local government have emergency management or plans, but the upskilling of existing physical resources and health workforce are still needed to enhance the direct responses. Okay, this is some policies or adaptation strategy for bushfire smoke. So actually, for the bushfire smoke, it is underdeveloped aspect of government adaptation policy. That means, currently there is no guideline to reduce the impact from bushfire smoke. This is similar, not only Australia, this is similar to other countries like US, Canada, or something else. And also, just few local government provide evidence of effective adaptation actions to protect the public health. That means more attention should be developed and is still needed to identify the most vulnerable populations. Because if we don't know which population, which group are more sensitive or are more vulnerable, we can't give a precision target. Like, if we understand the elderly, children, pregnant women are more affected, so we can develop a specific target, specific policy. We can collaborate with GP, with clinicals, and with education sector to mitigate the impact from bushfire smoke. And also, this means further research and policy development are still required. And cooperation and cross-jurisdictional collaboration are critical to promoting consistent responses, increasing the community confidence. Okay, so this is another indicator, that is floods. The left map, that is the annual average number of flood days exposed to floods per person in Australia. Okay, that is annual average number of flood days in Australia from 2000 to 2020. So we can say, so in general, that should be Queensland and New South Wales are more affected by floods. Okay, and the right one, that is the annual number of days exposed to floods per person for the temporal trend from 2000 to 2020. So we can say before 2014, there is an increased trend for the flood events in Australia. But after 2014, there is a little bit decreased trend. But this is just a very short-term time. We still need more data to say if the trend will be continue or the trend will be increased in the future. Okay. And regarding the policy or adaptation strategies to floods, there is already a national flood risk information portal to provide up-to-date flood risk information and tools to help understand and manage flood risks. And the government has also developed a national disaster risk reduction framework to reduce the flood risks. And all states have developed specific guidance documents or plans to address flood management and responses. And many local governments have developed flood adaptation policies and measures to reduce flood impact. But there are still some gaps. For example, there are inadequate long-term urban development planning and communication and community engagement issues, and also the resource constraints, and also the reusage of indigenous knowledge. Because sometimes the indigenous knowledge is very important because they have their experience that is helpful to improve the adaptation to flood. Okay, another indicator that is drought. The left map, that is number of months with drought in Australia during 2000 and 2020. So we can see in general, West Australia and the Middle Australia are more affected by droughts, and Tasmania also highly affected. And for the right one, that is the trend for the different number of months for each year from 2000 to 2020. So we can say in general, there is a variation for the land area affected by droughts. There is no clear time trend in general, but we still don't know in the future. But it depends on the other studies for the projection of future drought. There will be an increased trend. Okay. So here is some adaptation to drought. The Australian government has released the drought response, resilience, and preparedness plan to assist rural communities to cope with drought. And multi-water management strategies have been attempted to address drought-induced water insecurity. And also some initiatives, for example, the Future Drought Fund, interest-free loans, had a positive impact on farmers and communities. That is very helpful to mitigate the impact from drought. But the previous policies were poorly targeted and risked distorting farm input prices. And also extreme levels of adaptation are required because the mixture of industries might be changed. For example, some areas, if it's highly affected by drought, maybe the farm or agriculture will be influenced. There will be no agriculture industry in the future. Okay, and some degree of government provided drought support in Australia will be required in long term. Okay, here is another part that is specific for the climate sensitive infectious diseases. So Karen is expert in this area, so she gave a lot of input. So in general, both national and state government have developed their climate change adaptation plan to deal with food and vector-borne disease issues. However, Commonwealth, state, and the local government will need to amplify their joint work to prevent the spread of infectious diseases across the country. To date, there is no state or territory which has produced a specific action plan for infectious disease control and prevention in the light of climate change. And also, the development of a climate informed early warning system is needed to effectively control outbreaks of climate sensitive infectious diseases. So to be honest, I think with the group of the big data, with the growing of big data and machine learning, I think it is reasonable to develop a new model to do, the prediction or forecast for the climate change sensitive infectious disease. That should be very helpful to reduce the impact. Okay, this is a specific chapter that is adaptation for indigenous health, because we all know indigenous people are very sensitive to the climate change, to the extreme weathers, to the flood, drought, bushfire, and heat waves. So a specific plan should be developed because they have their specific behavior, their culture. We need to collaborate with them. So historically, plans and policies imposed on the indigenous communities have not been well received. So that means, even there is already some strategies, but they are not effective, or they should be improved. And there is emerging interest in integrating indigenous observations of climate change and developing intercultural communication tools. So this is very important. Of course, more works are needed. We should think about from the top to the bottom, and from the local community to the top, to the state government and to the federal government. And also we need to think about the personal issues and the personal communications. This is some recommendations for the communication and policy regarding about the climate adaptation in Australia. The first one, that is the health knowledge and information system. For example, we should try, or the government should try to enhance the data collection and analysis system. To date, because our group have done a lot of work for the data analysis, we know, it is hard to collect the data, and the government should or have to make their data public available, so everyone can can use the data to do something, to understand the evidence, because evidence is important. Okay, and it should be to establish a climate change, a climate health resilience research fund. Because we apply the ARC or HMRC grant every year, we can say the funding pool is decreasing year by year. It is very tricky for the researchers, but if the government can put more funding in this area, it's very important. And we should with together the Western and the indigenous knowledge systems, because the combination is very important. We can learn from each other. Okay, and the second one, that is the workforce. For example, we should increase the size, diversity, and preparedness of the health workforce. And also we should upskill the health workforce through collaboration between health and education agencies. So currently there is, the disconnection between the health sector and the education sector and the research sectors. So we have the evidence, and the education, the students can understand what is the problem. But for the health system, maybe they still don't know, or maybe even they know, but they don't know how to change or how to improve. So the collaboration is very important. And the third one, that is critical infrastructure, including the health services and the supply chains. For example, we should assess the current and future climate-related risks related to existing facilities. And also we should ensure the climate adaptation strategies consider the critical facilities, and also stress the personal, household, and the business resilience strategies and plans. For example, for the personal. So when you build your house, maybe you should think about how to fight climate change in the future. So equip the air conditioners, or equip the fans, and the ventilation of the house, and also some other, and also for yourself, your behavior. So drive cars, and maybe by work or by bicycle. So you should think about, okay. And the service delivery, that is, we should enhance the existing emergency planning. For example, the hospital emergency department visits, hospital emergency department, they should prepare more resources during the heatwave days or bushfire days. And for the ambulance calls, they can use precision process to allocate the ambulance at specific areas which are affected by the heat waves or bushfires. And also the government should support all healthcare systems and to develop the long-term resilience strategies. And the final one, but maybe a very important one, that is the finance. Like, we should, our government should ensure that the adequate financing is made available, and to help the health, to ensure the health impacts for the current and future generations are fully accounted. Okay, we should analyze the whole situation. Okay, I want to thank my co-authors, the team. So they have done the fabulous work. So, and for this series, we will continue for the next year, for the next several years. We can summarize the, the strategies, the adaptation policies, and update if there is any improvement. Hopefully, we can change something. There should be some positive feedback. Okay, thank you very much.
To introduce John G from, I hope I say right, Tsinghua University, who is going to present the equivalent paper from China. Thank you so much. I believe it's early in the morning for you, John. So thank you for getting up early, and we're really looking forward to your presentation.
Thank you for the introduction. And it's a pleasure for me to give a presentation on China's report of the climate change adaptation initiatives and China's climate risk. It was great to work with Professor Guo Yumin from Monash University as well on launching this series. Our series was supposed to be launched 2 days from now, but to meet Monash's climate change initiative timeline, the entire team, including the ones at the Lancet, put all the papers online last night. So congratulations once again on your climate change initiative. In China, I'd like to give you a summary of what's going on. A lot of people are familiar with China just because a lot of attention is being paid in China. This is the cover page of our Lancet Regional Health series, and this is a picture of a facility in Shenzhen. And this is to show you that adaptation initiatives need to take transportation into account, buildings into account, green space, social and leisure activity places into account, blue space, including water, and many, many things, and also energy use and renewable energy. The China report was co-authored by a variety of researchers from all over China, including the fields of public health, environmental engineering, economics, and so on. So China, typically, when you think of China, you typically think of this map, which is, according to people in China, looks like a large chicken. But what most people don't realize is that if you draw a diagonal line in the middle of China, 94% of the population live on one side and only 6% of the population live on the other side. And this makes climate change adaptation interesting, because China has many, many different temperature zones, and it actually, I think, encompasses all of the possible zones. So where I am now in Beijing, which is towards the north of China, is considered a continental dry winter. All the way to the south in Hainan province, also known as China's Hawaii, that temperature climate zone is a tropical wet climate. And over on the west of China are very high altitude and some of the coldest climates on the planet. So China is very diverse. So how do you have a adaptation plan that covers every region? We cannot. So one must have a different plan for each area. And because of the differences in climate zones, China has different regional weather extremes. In the northwest of China, there are melting of snow and ice because of rising temperature, and snow melt flooding is frequent, and vulnerability of water resources and ecosystem is increased. In eastern China, where I used to live, such as places like Shanghai, or Suzhou, some of these more famous cities, there are typhoons with increasing intensity, and flooding and heat waves have also increased. The rising sea level is also a threat to coastal cities. In South China, there are extreme heat waves because of the geographical region, also leading to unpredictable rains and floods and other types of natural disasters. So China is very diverse. That's the first point of this commission report. What is the government doing about climate change adaptation? The adaptation policies in China was first mentioned in 1994, but it was subsequently mentioned again in 2007. This is putting together all of the Chinese language domestic policies that mention climate change adaptation. And as you can see, there has been increasing frequency and density of climate change adaptation plans on a national level in China. The most famous and important report is this one, and it was written in 2022 last year in May, and it's called the National Adaptation Plan to Climate Change Strategy 2035. So the goal extends to 2035. And these are the chapters of this important plan written by the central government. It was translated by Georgetown University, and this document covers the periods 2022 to 2035, and it replaces an earlier strategy. The new strategy isn't necessarily very focused on health. It's actually more comprehensive and extends to all sectors. It aims to make China's society and economy more resilient in the face of climate change by monitoring climate extremes, floods, resistant crops, farmlands, and other measures. So basically, it's to protect the society from the changing climate. Health was mentioned in this document, which is good, but not made a central point. The authors include, as you can see here, the Ministry of Ecology and Environment, the National Development and Reform Commission, which is responsible for commission large-scale infrastructure developments, Ministry of Natural Resources, Housing, etc., and Transportation, Water Resources. So as you can see, this is a comprehensive report. On the international front, China has been a participant in the United Nations climate change mitigation and adaptation initiatives from the UNFCCC. China submitted its first national determined contribution to the UNFCCC, part of the Paris Agreement in 2015, and in 2021 has submitted a second NDC. So the most important international policymaking in China is the NDC from 2016-2021. The CO2 peaking is going to occur before the year 2030, which is coming up, and a lot of economists are trying to estimate exactly which year is going to be the peak of China's carbon emission. I think what's important for us to look at is perhaps some of these large goals have health co-benefits. And the one that I see that has the highest potential is the increased forest stock volume by 2030. And that's the increase by 6 billion cubic meters, which is roughly the size of England in terms of forest volume of increase in China. And this could have potential health implications because of higher green space. What are the climate risks? It's very hard to predict climate risk, but here is a list of extreme weather events in many parts of China. As I can imagine, this is probably the same in Australia as well. The frequency, intensity of climate extremes has been increasing. Compound events is one aspect that we aim to cover. There is no official definition for compound events from the IPCC report, but it's typically multiple occurrences of climate phenomenon that occur together. This past summer, living in Beijing, I've experienced one, which is an extended period of heat wave days, with some days over 40 degrees, followed by a dramatic lethal flash flood in Beijing and the nearby Hebei area. And this occurred within 2 weeks of each other. The adaptation efforts is going to be pushed to the extreme. The second one would be deforestation and sandstorm. So hopefully with the increased forest volume, this could be prevented in the future. Yeah, from Mongolia, from the Mongolia side, there are the Gobi Desert and sandstorms. And these sandstorms get blown over to the western part of China, and almost on a yearly basis, there are severe sandstorms that sweep through Beijing and several of the northern provinces. Sandstorms, like weather events and lethal floods, have this system where there are warnings. So yellow is a warning of high concern, orange is very high, and red is extremely, extremely dangerous. There are many research on air pollution in China. As you probably know, China has some of the highest levels of urban air pollution. But the interaction between PM 2.5, nitrogen oxide, ozone, and heat waves are going to be the next area of concern. Ozone pollution and ozone exposure has been linked to health outcomes, mostly in southern China, in the Guangzhou province. But the effect of ozone in other parts of China need to be better studied. In northern China, because of the reliance on coal-powered fire plants as a mean of heating and also industry, there has been lots of pollution. Cyclones and floods and disaster management is also becoming more common, but mostly in the eastern part of China. Climate-sensitive diseases. Now, here we relied on existing literature evidence showing that cardiovascular disease and chronic respiratory disease are the two chronic diseases most impacted by climate change. And heat waves are going to increase the burdens of diseases for these diseases. However, there is unknown information on what other diseases are climate sensitive, what are the direct and indirect impact, and how to analyze lag effect. And these are questions that are largely unknown. The number of heat waves is increasing in China. Here are some density maps of the percentile of daily maximum temperature in different regions of China, and the number of days where the mean temperature is above 35. So as you can see, there is a geographical variation due to different climate zones, but also this could reflect some of the urban heat island effects because China also hosts some of the largest and most densely populated megacities globally. One Health and infectious diseases is an area that may be impacted by changing climate and heat extremes. Most of the One Health issue areas, but not for all diseases, maybe in the Yunnan, in the parts of China that juxtaposes Vietnam and Laos, are typically areas where infectious diseases are prone, but these vector-borne diseases and rodent-borne diseases have been continuously monitored in all parts of China. How climate change can change these disease patterns is also unknown. Climate change can impact labor productivity, and many studies have shown that high temperature events affect labor productivity, lowering the GDP of China. We also added a new section on climate and food system from reviewer comments. So I know I'm running out of time, so I'd like to quickly push through some of the climate change adaptation initiatives in China. We listed a total of 8 areas that is important. One is to study what are the co-benefits from carbon emission reduction. How does reduction of carbon dioxide emission and greenhouse gas affect health? And here we talked about the potential benefits to the ecosystem and ultimately health from the China's NEC. China currently has an early warning system, and it looks like this. So we have it for cold waves and heat waves. So the red color is the worst. However, this temperature early warning system is based on absolute temperature, but not relative temperature. And we're currently writing a paper to see what are the epidemiology evidence of absolute versus relative temperature on actual health outcomes. And it appears to us that relative temperature is more predictive of health outcomes. So one recommendation is to change the absolute temperature system into a relative temperature system. The third initiative is city and spatial planning. China is very good at this because all the land is owned by the government, and which makes city and spatial large infrastructure projects easy. Here's an example of a pilot study of a sponge city. Natural ponds may help preserve the precipitation and ecological corridor. And this is the city Qian'an in China's Hebei province. And this is to prevent against future floods by acting as a sponge barrier. These pilot cities have been in place since 2015, and they are and they are at the right time to be studied in terms of health impact. Indoor environment needs to be optimized for heat waves, because the general clinical recommendation right now is to stay indoors if there's a heat wave. But in indoors, what are the infrastructure that may be available, and what are the extreme cold, and how do you deal with extreme cold? Now, we may think of indoor environments as typical apartment buildings, but that's actually not the case for all of China. These are pictures taken by my student over the summer from her internship. So most indoor environments look like either the one on top or the one on the bottom. So the one on top is before relocation in improvements, and the one on the bottom is after relocation improvements. So in these types of resource settings, how can we improve indoor environments, and obviously how to regulate temperature in a way that does not cause indoor air pollution. Green space and vegetation need to be increased. There has been mixed findings of whether green space is increasing in China. In some places that are doing really well, like Shenzhen in the southern tip of China, also known as the Silicon Valley of China, green space planning is really good because of the conducive natural environment and also planning by the city. This is a highway in Shenzhen, a time series. So as you can see on the left hand side, that's before, and over time you're seeing slowly more and more green space that gets put in over time. Public awareness in protecting vulnerable populations for heat-related risk is going to be an important area. There has been a little bit of qualitative study, but not too much on exactly who is vulnerable. Currently, the clinical guidelines say age, gender, and those with comorbidities are more vulnerable. But this is, I think, a lazy generalization of the actual vulnerabilities in China, and this area needs more study. Environmental engineering and technologies for health, controls of PM2.5 exposure, and also controls of new organic pollutants and novel technology for climate adaptation is necessary. And the health impact need to be accounted for. This is a picture taken in Shenzhen, where we wrote about in our case study in our report. So yeah, you can see here the photovoltaic rooftop in a building can act as a barrier to heat and also generate electricity that helps power the many air conditioning units in the building. Government academic partnership in science and technology is going to be important. I think some of the policy documents in China could benefit more from citations of scientific evidence, but there has to be more scientific evidence to be there in the first place. In conclusion, China has changed dramatically. This is this is Shanghai and Suzhou, so you can see where Shanghai is in the black block. That's the city center. And after about 20 years, Shanghai and Suzhou have almost become one city, indicating the dramatic change in urban landscape in China. And these are the landscapes that's going to have to adapt to future climate changes. So once again, thank you for inviting me to speak at Monash, and I hope our climate change adaptation work can continue in the future.
Thank you so much, John. That was absolutely fascinating. I have to say, I don't know that I had realised the variability, the extreme variabilities that you have across China. I mean, we obviously have a very different landscapes across Australia, but you know, the cool and the sea level rise and everything that you describe, you know, it's really fascinating. So are you okay if I open it up for questions? You able to stay on? So Yiming as well. Grant.
你好 ，John。我是一向我是墨尔本大学的教授和 Monash 大学教授。我出过中国深圳罗湖。我叫家庭医生。我有新说心理健康的上课医学。My question is, are you thinking about mental health also and the impacts?
Thank you so much. 非常感谢你的问题。你作为一个心理医生，是一个非常需要的职业。Mental health, according to the global burden of disease, has been increasing dramatically in China. I did not consider mental health in this commission report, but I think perhaps in the next commission report, mental health could be an aspect that we study. Obviously, as we can imagine, the extreme weather events could have acute and long-lasting mental health outcomes. And I would like to invite you to give us some ideas of how to study this from a climate change adaptation perspective.
Yeah.
Yeah, I have a good PhD student who just completed her PhD on mental health in China, and I'm very happy to connect you up. She would be very interesting, Kendall Searle. So I'll do that through Karen.
That's
太
fabulous.
棒了，那我们以后一起见个面，一起见面来讨论一下，谢谢你。
Thank you.
Actually, John moved to US at 8 years old, right? So he lived in US for more than 20 years. He moved to China for getting Tsinghua University. So his Chinese maybe similar level.
I think I'm helping, but I'm not worse.
Good.
I think
Other
the hard
questions?
part is to be able to write in both languages, and Professor Guo Yumin can do it at a very high level in both languages. That's the hard part.
I hope.
Thank you, Karen. Thank you, Professor Guo, and definitely, as said, Professor John, very fabulous presentation and very useful. I want to know actually more about the preventive strategies, like you discussed more about what's happening in China as well as adaptation strategies. Rather than I want to actually know more about the preventive strategies that the government is actually taking to tackle this climate change and what are the main causes. And definitely we know that there is a big role for the human actions and how we can actually reduce further impact of human-induced climate change. Thank you.
Very much. John, you have your
From my reading of the government reports, so health is not really the primary goal of climate change adaptation. I think the mentality of the government is thinking of adaptation in terms of how does our economy have to evolve to survive in a changing climate, and how the economy has to revolve under the context of carbon neutrality and renewable energy. And health is talked about, and health is mostly, I think, delegated to the National Health Commission sectors, which manages hospitals. So it's hard to see what kind of actual power or resources the Health Commission has on climate change adaptation, because a lot of green space buildup is approved by the Ministry of Environment and Ecology and Urban Planning. And those have very little capacity to understand the impact on health. So I think there's a mismatch of the endpoint being managed by the health departments and the exposure side managed by other departments in the government. So they're going to have to collaborate. I've attended some meetings by the China CDC, which talked about health, climate change adaptation, at the Center for Disease Control and Prevention. So I think we're moving in the right direction, and is very much on the government's radar. But the big problem is that the cooperation for health impact is really lacking.
Yeah, thank you, John. I totally agree with John. Another thing that is, if we want to prevent the impact from climate change, generally there are two parts. The first part is climate change mitigation, and another part is climate change adaptation. But currently, we can say for the mitigation of climate change, it is very slow. And even we take effective action from today, the climate change is already happening, and it will continue. That means we should seriously consider about climate change adaptation at this stage, because climate change can't be changed in the next 10 years or 20 years. So we should do both, but climate change adaptation is very important at this moment. So like John said, green space, or maybe personal behavior or something else, we should be developed to adapt to the change of climate. Yeah.
Thank you, Joe and Yumin. I'm Rongbin. I'm the first author of the Australian report.
Congratulations.
Thank you, everyone. Yeah, and I read John's presentation. It's a really great presentation. I'm impressed by Chinese report, which is a lot of diversity, and we saw many impressive interventions and innovations to climate change adaptation and mitigation strategies. So, which is quite different. Like when we write the Australian report, we found there are not so many interventions, and the government's interventions and strategies, such as the urban green infrastructures and all those interventions, they are moving very slowly. So that's why I'm quite impressed by the Chinese report. Like there are so many interventions, innovations. So my question for John is like, from your experience in writing this report, so how those innovations and interventions, such as the urban green infrastructure, really happened in China? What's the lessons did you learn from this, and what's the lessons you can share with other countries? So for example, Australia can learn from this. Yeah, thank you.
Thank you, Rongbi, and congratulations on the report. I read so many papers from you. You're quite famous. And I think overall there is a developmental mindset in China. So as you can see from this image, the improvement from the first top to the second in terms of homes. So there's a developmental mindset in China of how to make communities better. And I think second, China just has very high population density and higher urbanization. Urbanization is generally thought of as positive for population health. Urban residents live on average 6 to 7 years longer than rural residents. Globally, urban residents live a little bit longer, but not that much longer. So there's a large gap between urban resources and rural resources. And generally, urban environments up to 10 years ago is plagued by air pollution, but air pollution is decreasing. Urban green space is increasing, but I have to say, urban green space is not increasing because of the goal of getting better public health outcomes. Urban green space is increasing because each locality is trying to outdo each other with the percentage of green space coverage. I think it's as simple as that. And I conducted some of the earlier green space and mortality prevention studies in China, showing that changes in green space is strongly associated with changes in mortality in the elderly. So I think these type of initiatives just sort of happen, and the health impact is considered, I think, a positive externality. What I'm trying to figure out in the next couple of years is how to turn these positive externalities into the primary endpoint of these initiatives. And that involves, I think, stepping out of the academic environment and engaging with policymakers. And that's what we have been doing. So 2 weeks ago, I went to Shenzhen to meet with the municipal planning and the policymakers there to try to take some of these findings to into the public policy space.
Okay, this has just been absolutely fascinating. I really think it would be great if we could think about in the new year getting all 6 of the countries that have done this together and thinking how we can learn from each other, because I agree with you, Rongbin, there's lots of incredible initiatives going on. The Climate and Health Initiative that we launched this morning, John, was really to try and have as one of the messages that goes to government, how important it is to have health be part of the conversation of climate change, take it out of politicizing and actually, I think there's pretty unanimous goodwill in terms of improving people's health and understanding that how much health is affected. And we just have that as another lever that we need to pull, but we need to pull it hard, because as we showed, or as you guys showed in this review, we've got a lot of work to do in Australia. But I think that there's a lot that we can learn from each other, and I'd really love to have the conversation continue. But I am conscious of the time, and a lot of you got here pretty early this morning. So I'd like to, first of all, can we thank Yuming and John for their fabulous presentations. Thank you everyone for joining us. And let's keep the discussion going, because there's lots of work to do. So, thanks everyone.
Thank you, John. Maybe see you later.
Okay, see you later. I'm signing off now.
We need to meet on Saturday.
And all the series are online now. So if you go on the Lancet website, you can see it. It's part of the Lancet has a lot of series, so it's part of the list now. It's called Climate Change and Adaptation in the Western Pacific. We're excited to launch this. So thank you, Emias. Thank you, Roman. Thank you, everybody. Take care. Bye.
Bye-bye. Have a good day. Bye-bye. Thank you.